Pleasure to call to order the Board of Health, King County Board of Health meeting for Thursday, September 17th, 2020. Madam Clerk, I'd ask you to please call the roll.
Thank you, Mr. Chair. Board Member Cole-Wells.
Here.
Board Member Lambert.
Here.
Board Member Dembowski. Board Member Lewis. Board Member Morales.
Here.
Board Member Mosqueda. Board Member Gonzalez. Board Member Baker. Board Member Honda.
Here.
Board Member Zahn.
Here.
Board Member Marks.
Here.
Board Member Daniel.
Here.
Board Member Delucky. I think I just saw him come in. Board Member DeCastro.
Here.
Mr. Chair.
Here.
Mr. Chair, you have a quorum.
Board Member Delucky. Is here. We'll have his full participation in just a minute in the Zoom video meeting. As we begin today, I'd like to acknowledge that we're on the traditional lands of the Puget Salish peoples, past and present. We want to thank these caretakers of these lands who've lived here since time immemorial and continue to live here and care for the land. And also to acknowledge the contributions of many urban Indians who make King County their home and have brought their traditional ways of life here as well. Madam Clerk, are there any alternates serving in the place of regular members?
Not that I'm aware of, Mr. Chair.
Board Member Delucky, I'd entertain a motion to approve the minutes of our July 16th meeting.
Chair?
Council Board Members on.
Yes, I am the representative in place of Mayor Baker, who was not able to join today.
Very good. Thank you. And Council Member, Board Members on, when you have your mic unmuted, would you move adoption of the minutes?
Yes, I move adoption of the minutes, Chair.
Thank you. The minutes of our July 16th meeting are before us. Is there any discussion? Seeing none, all those in favor of approving the minutes, please say aye.
Aye.
Aye. Opposed, nay. The ayes have it. The minutes were approved. As we take up public comment at today's meeting, I want to be sure that we have a chance to hear from everyone who's called in. It greatly enhances our work as the Board of Health. Having virtual meetings like this during the pandemic is still virtually new for all of us. And so let me go over how public comment will work so that everybody understands that we can make sure we have everyone's full participation. All members of the public, as they join the meeting, were automatically muted. We can see your names or the last 3 digits of your telephone number. Our clerk will call your names and or the last 3 digits of your phone number to provide public comment. At that time, staff will unmute your line. Please make sure also to unmute the telephone on your end, the connection on your end, if you have muted yourself as a courtesy as well. And then before you begin your full testimony, if you would perhaps state your name and pause, giving us the opportunity to confirm that we can hear you. And then if you proceed by saying and spelling your name, so we're going to have an accurate record of who testified today. I'd ask you to limit your testimony to 2 minutes. At the end of 2 minutes, you'll hear a timer go off. And please finish your thought, but do wrap up your comments to allow the next person to speak. If you go much past 2 minutes, you may be muted. And if you're listening on the TV stream, we ask you to please turn that function off when you're offering testimony. Otherwise, we will hear an echo. Though I don't expect it to be the case, and it hasn't traditionally been at the Board of Health, I will note that if you're disruptive to the meeting, we may need to dismiss you, remove you from the video call. After you've hung up after you've provided your public comment, I would invite you to make it easier for us to manage the call to follow the remainder of the meeting on King County Television, Channel 22, or to stream the meeting online. The streaming can be found at www.kingcounty.gov/council, and then click on the ever popular Watch Us Live button. We'll now begin the public comment period. A reminder to wait to state your name when you begin and wait to be acknowledged so we're sure we can hear you, and then to spell your name for the record. Madam Clerk, would you please begin?
Thank you, Mr. Chair. The first person on the list is Kim. You're unmuted. Please go ahead.
Oh, I'm sorry, I didn't hear you. I'm just listening today. My name is Kim, K-I-M. Thank you.
Mm-hmm. The next person on the list is Kirsten Miner.
Can you hear me?
You're a little bit soft.
Okay, I'm going to work on my microphone. How's that?
Better, thank you.
Thanks. So my name's Kirsten Gemeiner, spelled K-J-E-R-S-T-E-N, Gemeiner, G-M-E-I-N-E-R. And yes, I've had some problems with that. I live in North Seattle, Pinehurst area, and I've been a family physician for 20 years. I am commenting today on the proposed merger of Virginia Mason and CHI Franciscan, actually should be called the buyout. I asked the board today to take a position on this transaction due to its huge negative impact on public health, potential negative impact if we don't do something. In the wake of the expanding access to family planning in the 70s and 80s, what the religious right did is when they lost in the courts, they just started buying healthcare delivery. Unable to succeed in making family planning services illegal, they have proceeded to just make them more and more unavailable. You see this nationally. I'm sure you're all aware of it. They are completely succeeding. 1 in 6 hospital beds in the U.S. are Catholic-owned. Common Spirit, which owns Franciscan CHI and which is buying VM, is the second largest hospital system in the United States. 41% of the hospital beds in Washington state are currently Catholic-owned, and this buyout will make the number greater than 50%. If this merger goes through, the only hospital in each of 4 cities in the state, Bellingham, Centralia, Walla Walla, and Yakima, will be a Catholic hospital. Washington will lead the nation in the number of hospital beds controlled by the Catholic Church. And the impact of this, it's obvious that VM will immediately end abortion services, but a lot of things that not everyone thinks of will also go away. Full non-judgmental services for transgender and LGBTQI population, access to many legal forms of reproductive care, including contraception and abortion, elective vasectomies and hysterectomies, full spectrum, adequate end-of-life care. Is that 2 minutes?
That is 2 minutes. Please finish up, though.
Okay. Also, life-saving services for those experiencing miscarriages. And I'm going to go completely off script here and just tell you that in miscarriages and 20 to 25% of pregnancies, it's just a fact of life. And in some cases, those are life-threatening, complicated procedures, and they need surgical intervention. It's been shown that hospitals around the country that are Catholic-controlled do not manage those life-threatening circumstances adequately, and women get the equivalent of undeveloped third world rural obstetrics care. And so I'd like you to intervene and try, and at this single point of leverage in the contract negotiation, make sure that there's some assurance that all of those services that I enumerated will be protected for our people in Washington state. Of course, this has a huge racial equity component. Thank you so much for your work.
Thank you. Next on the list is Alexis Mercedes.
Hi, Alexis Mercedes, Rehnquist Cities Association. Just here as staff, no public comment. Thank you.
Thank you. Next on the list is Allison Grand.
I'm just monitoring the discussion for news coverage today. Thank you.
Thank you. Next on the list is Dennis Barnes.
Thank you. My name is Dennis Barnes. You hear me okay?
I can. Please go ahead.
Okay, thank you. I live in Lake Forest Park. And I want to comment today on the proposed merger of Virginia Mason and CHI Franciscan. And I also asked the board oppose this transaction due to its negative impact on public health in King County and elsewhere in the state. Virginia Mason's CEO, Gary Kaplan, has claimed that the merger is necessary to improve the quality of care at Virginia Mason, and I have no doubt that the additional capital would provide resources which might indeed improve some forms of care, but nonetheless, they would become subject to the ethical and religious directives of the Catholic Church, the ERDs, a list of medical procedures deemed intrinsically immoral by Catholic bishops with no medical expertise. And it's hard to think of the word quality when these essential services like life-saving procedures for miscarriages, transgender and LGBTQ services, access to all forms of reproductive care, including voluntary sterilization, end-of-life options, and procedures for infertility surrogacy and in vitro fertilization. But aside from the loss of these so-called controversial services, consider my own example. A while back, my wife and I found ourselves overwhelmed with 4 children, the last 2 through unplanned pregnancies. We elected to get a vasectomy, and it was the best choice for our family. And that procedure was done at Virginia Mason. As a result of this merger, that would be denied along with other similar services such as tubal ligations. I think this illustrates the extreme nature of these directives and how out of step they are with public health needs. I urge the board to register their disapproval of this merger. Healthcare must continue to be provided based on medical and scientific information, not by moral judgments or religious doctrine. Thank you for your time.
Thank you. Next on the list is Erica Barnett. Please unmute yourself if you'd like to give public testimony. Next on the list is Jeff Sakuma.
Just monitoring the meeting for the city of Seattle. Thanks.
Thank you. Next on the list is John Witzman. Next on the list is Maria and Grace's iPhone. Next on the list is Marley Banker. You're unmuted.
Hi, my name is Marley Banker, and I'll spell that for you. It's Marley Banker, Banker. And I live in Lake Forest Park.
Please go ahead.
I'm here today to ask you to endorse the Approve R90 campaign. As you know, R90 would uphold the new Washington law requiring all public schools to teach age-appropriate, medically accurate, inclusive, comprehensive sex ed to our K-12 students. Upholding this law would benefit our kids and our communities in so many ways. The King County Board of Health is a public organization working for the health and safety of our communities. Your position on this referendum matters, and here's why. First, endorsing R90 shows your support for reducing the number of kids who are sexually abused. Young kids who are being abused need the tools and language to communicate to a trusted adult that they're being hurt and need help. Mandatory comprehensive sex ed can provide them with these tools. Endorse R90 because you would like to see a reduction in the number of kids who are abused. Second, endorse R90 because sex ed is so very important in lowering the rate of teen pregnancies. Third, endorse because R90 would ensure that Washington students would receive LGBTQ inclusive sex ed. This means that all of our youth would be seen and valued for who they are as people. The effect of this will be far-reaching and will likely result in the reduction of LGBTQ teen suicides. Endorse because you support the well-being of our LGBTQ youth. And last, endorse R90 because it would ensure that comprehensive sex ed in Washington teaches affirmative consent. Any sex ed curriculum must include teaching about consent if we want to see a reduction in sexual assault. Many health organizations have already endorsed R90, and I urge you to join that list to publicly state that you are looking out for the health and safety of our kids. And I can email you the contact information about how to do the endorsement process. Thank you.
Thank you. Next on the list is Nori De La Pena. You are unmuted. Please go ahead.
Nori Del Pena, just listening in, part of the community wellness or community well-being group.
Thank you. Next on the list is Alexia.
Hi, yes. No public testimony at this time. Here as a listener.
Thank you. Next on the list is Sylvia Furstenberner. You are unmuted. Please go ahead.
Good afternoon. I'm Sylvia Furstenberg. I'm the interim CEO for Crisis Connections, and I am here really just to listen in. One of our staff will be presenting later. Thanks.
Thank you. Next on the list is Wayne Lau.
Wayne Liao, just listening in. Thank you very much.
Mm-hmm. Next on the list is West Ju.
This is Julie West, just listening in today.
Thank you. Next on the list is Zara Hassan. You're unmuted. Please go ahead.
I'm just here to listen.
Thank you. And last on the list, Mr. Chair, is last three digits 922. You are unmuted if you'd like to. Hello?
Yes, hi. My name is Laura Van Tosh, Laura, V as in Victor, A-N, capital Tosh. Thank you for the opportunity to provide public comment. And hello, Council Member McDermott and all. I served as a member of the Public Health Wellbeing Task Force. I just wanted to mention that it did conclude its work, but I know that some of the outcomes of that task force are moving forward. My comments are regarding the smoke shelter in Seattle, King County. We have a smoke shelter in Seattle, King County. It opened on Friday, September 11th, and every day it is extended yet another day. The smoke shelter houses about 100 homeless people. I've been advocating that while they are inside, homeless people are heard and action is taken if they'd like to end their homelessness experience and access housing. This action has not been mentioned as occurring. However, healthcare needs are being tended to, and an increasing number of staff seem to be appearing as the days go by. It would seem a waste of time, resources, and human potential not to be prepared for someone to look up from a cot, which is what folks are sleeping on, and wonder about the promise of life off the streets. Two county council members, one city council member, and city staff have all agreed. And they are County Council Member Balducci, Sahile, Council Member Lewis, and Mary Flowers, a staff person. This is what I am this is what I have stumbled into, advocating that we are nearly in these emergency circumstances to help anyone make homelessness history. Throughout the height of the COVID crisis here, I thought similarly as we hustled people into isolation and quarantine centers, only to turn people back to the streets. An exit ramp must be built if someone wants off the road. My final comment is I'm very supportive of Proposition 1, which will be on the ballot to develop a new, it's a Harborview Medical Center measure. And I'm really hopeful that included in that new complex, if it's approved by voters, that we can have additional services for crises if they occur like they have here in 2020. Thank you very much for your time and have a good meeting.
Madam Clerk, is that the conclusion of people you know of for public comment?
That is the completion of my list, sir.
Then let's make sure we haven't missed anybody. And this may be chaotic for a moment, but I'm going to ask the clerk in a moment to unmute everybody. And then I'll ask if anybody was missed and would like to offer public comment. That's your chance to speak up. Maybe say your name, and we'll take a list and hear from anybody who's remaining, and then proceed with the meeting. So with that, Madam Clerk, if you would unmute everyone on the line. And everyone is unmuted. I would ask if there's anyone else on the line who would like to offer public testimony. Anyone else who would like to offer public testimony? Thank you, Madam Clerk. If you'll remute the lines, I'll be prepared to unmute myself.
Thank you, Mr. Chair.
We figured out that I have to be ready to unmute myself when we do that. I want to thank everybody for their public comment today and joining us for the meeting. That takes us to the rest of our agenda that will include a report from the Public Health Director, Patty Hayes, a briefing on the impact of COVID on the behavioral health needs of King County residents with staff from Crisis Connections and Public Health, and an update on planning for flu and COVID this upcoming fall and winter season. I expect that we'll hear repeatedly this season, so I'll be the first to say it in this meeting. Please get your flu shots early this year if you're medically able to do so. I also have updates on progress on our annual work plan. As you will recall, one of those items on our work plan is the risk posed by unintentional access of young kids to marijuana candies. And I appreciate the email Board Member Baker shared with an update on this work, as well as next steps that we're outlining. Thank you very much, Mayor Baker, for that. And we've also been in touch with our gender-based violence subcommittee community co-chairs, Sophia Locklear and Mary Ellen Stone. They have requested that we continue to hold on convening the subcommittee until next year, as their capacity during the pandemic is limited. However, they did request that we continue to engage in these issues, to consider opportunities to support anti-violence work, including through our legislative agenda, and they look forward to reconvening in the new year. Here we are in September already talking about the new year. Kind of floors you, doesn't it? And with that, I would turn it over to Director Hayes for her report. Good afternoon, Director Hayes.
Thank you, Mr. Chair. Really appreciate it. Appreciate your pitch for the flu vaccine. Really very important this year, and we'll talk about that more later. So I have a few items to update the board about. First, starting with air quality. Boy, oh boy, what a hard year this is. And we know that Seattle area, King County, along with some of the other large cities on the West Coast and indeed Oregon, almost in total, has some of the worst air quality on the planet right now. And so we've been so concerned with our population. And I'm happy to say that even though the weather report keeps changing, as I think the weather systems are fighting each other, it looks like as we move into Friday, we will move out of the unhealthy category. We have been in the very unhealthy for everybody category, but we will be moving into a time where it's unhealthy just for a high-risk group. Still not great, but it is better. And we just really, it's been a double slam for so many people. I want to flag that the smoke has created a depression or a loss of the number of testing for COVID that we would have expected. And I'm going to talk more about this later. But I just want to flag that because I think our case counts are a little artificially depressed about that. It's not totally reflective of the disease burden. I saw an uptick yesterday of the cases, so I know that everyone is working to get the testing done, but people who need to stay home are hopefully doing so, and we did have to, because of the air quality, close some testing sites last weekend. I want to give a few updates from Environmental Health Division. I will send you some additional information following the meeting, but our project that we've done, Safe Starts for Taverns and Restaurants, is fully operational now. This is a project to increase compliance rates with Governor Inslee's Safe Start reopening requirements at bars, restaurants, and taverns. Leading with outreach and education, the program is working with restaurants to provide technical assistance to ensure food establishments are meeting these prevention requirements. They have prioritized some of the areas that we know are the highest risk and where we have seen some outbreaks. So we really started the work in bars and taverns. But we're looking at 9 COVID prevention measures, which are whether or not employee symptom screening is occurring, whether or not there are employee face coverings, whether or not employees are socially distancing as much as possible, the correct seating capacity for the phase we're in, the elimination or no bar seating, which is part of the governor's order, customer face coverings, customer physical distancing and table spacing, and then whether or not the establishment is offering customers a method to voluntarily provide information for contact tracing if they would desire to do that. Establishments identified to be in non-compliance are offered technical assistance to help understand where the correction measures are necessary. And then those who are in a higher risk category will receive a follow-up visit. So if we go in and we see some of these 9 areas, especially some of the top ones I talked about related to staff and table capacity, et cetera, we follow up within 72 hours to verify compliance. And our goal is to help restaurants come into compliance through education and technical assistance. In limited circumstances where establishments continue to be non-compliant after we've given technical assistance, or if we find that there's a present imminent health threat, or if there is a combination with an outbreak, we do have the authority to suspend permits until compliance can be assured. Our team has focused this proactive work where we're seeing, as I said, the most risk, and we are conducting site assessments in working closely with community-based organizations, members of the hospitality industry, and other stakeholders to really assist and help alleviate barriers that food establishments may be facing, including communities who are disproportionately impacted by COVID-19. So our small businesses in BIPOC communities, we're doing a special effort to make sure that there is an understanding in their language preference so that they can understand the governor's requirements and that we can provide technical assistance. The program also represents exemplary establishments that we're finding who are meeting all of these measures, and we have been spotlighting that through social media. In addition, to attend to the financial strain for food establishments, the program has offered 2 permit renewal due date extensions, as well as offering to waive late fees. As of last week, about 8% of the permitted food establishments, that is about 1,000. So that tells you how many food establishments we have here in King County that have not renewed those permits. We know that a subset of those that have not renewed have been temporarily closed, possibly permanently. Therefore, we are obviously they're not receiving inspections, and we keep them on that list of non-renewal until we hear whether or not they're able to open back up. We are planning to offer permit proration to the establishments that have been closed since March, and for those when we plan or who are not opening until after September 30th. For those establishments that are in that, we would prorate their annual permit to 50% reduced cost, and we offer the prorated permit to those that have been already renewed as well. So that is a really positive program to try and support these businesses during a really difficult time. So on the good news front, the Spring Beach on Vashon Island, the shellfish harvesting acreage was upgraded. So this is really good news. For decades, sewer from about 12 homes in the Spring Beach community on Vashon was going into Puget Sound. In 2017, after a lot of investments from property owners and years of work to coordinate on a wastewater treatment solutions, the homes were disconnected from direct discharge and connected to on-site sewage systems or a community on-site septic system. This means that untreated human waste is no longer going into Puget Sound on that beach. And after what's called a resting period for 30 months, which allows the virus to be cleared from the shellfish tissues, the Washington State Department of Health shellfish program upgraded 57 acres of shellfish harvesting beds at Spring Beach. Community members who invested time and resources in improving their wastewater now have the assurance that the water on their beach is clean. Tribal shellfish harvesting has also reopened, and that's a critical ceremonial, subsistence, and commercial resource. It's just been a really great win. With that, Mr. Chair, I'll hold any comments on COVID and our status till we do our presentation later. Thank you.
Thank you, Director Hayes. Catching that caveat that we're holding COVID conversations for the briefing later in our agenda. Any questions of Director Hayes? Board Member DeCastro? No, you're waving hello. Board Member Morales?
Thank you. Good afternoon, everyone. Director Hayes, I'm not sure this is the appropriate place to ask this, so if I need to wait or have a conversation with you later, that's fine. I appreciate the update on the impacts on our restaurants and small businesses. I'm also interested in hearing about our farmers markets and any changes to operations and customer capacity that might be coming in that regard. I know grocery stores have lots of people in them and those are indoors. So our season is about to wrap up, but I am interested in understanding a little bit about whether for the last 6 weeks or so, there would be changes there. And then similarly, this might be a Seattle specific issue, but around playgrounds and the ability for kids to be outdoors and taking advantage of playgrounds, whether there are any changes that would be coming, directives from the public health department about the ability of kids to be in playgrounds and parks if they're wearing a mask and assuming physical distancing.
Thank you. I'll have Ann follow up with your office on the farmers markets. Our staff has been looking at the guidance that they've put out for farmers markets. We've gotten quite a bit of input, but we can brief you on the latest with that. I don't have that in front of me, so happy to follow up. In terms of playgrounds, the city of Seattle has asked me a couple of times about playgrounds and their decisions around closure or opening of playgrounds. We have just been following the guidance from the state. We haven't done any separate guidance on that. So this has been just a discussion back and forth in terms of capacity with the parks, et cetera. And I don't have the latest. I haven't talked to Deputy Mayor Fong about it in a few weeks. So we can follow up if there's a specific question on that. But it's just, we've been just reflecting the governor's guidance on parks. Thank you.
I have a question.
Board Member Mosqueda. I'm sorry. Board Member Mosqueda, did you have a question? Go ahead.
Yes.
Board Member Honda will get you right next.
Thank you, Mr. Chair. Thank you again, Director Hayes. Good to see you. I'm glad to see you in good health. I know you've been out there with much of your team, so I'm so happy that you continue to have good health and your team does as well. We really appreciate all that you're doing right now. I had a question, and I was looking at the summary of the presentation coming on mental health, suicide, domestic violence, and community well-being on COVID. But I wondered if I could put this question out now, if it's appropriate to answer now, or if it fits in later, that's fine. Could you comment for us to provide clarity in our region about the possibility of the vaccine, given the mixed messages we heard earlier this week about a possibility of a vaccine? Could you remind us what you're hearing about the earliest in which that you think it might be first disseminated? I'm hearing Q2 or Q3 of next year. And any caution that you have, a clarification on the caution about the potential efficacy rate, and again, I think underscoring that masks are the most important thing right now, regardless of whether or not there is a vaccine on the horizon. Could you comment on the need to continue to wear masks, even if and when a vaccine is available sometime next year? I think the efficacy issue was a little confusing earlier this week from the national conversation as well. So any additional comments from your expert perspective here would be greatly appreciated.
Well, thank you for the question. And the good news is Dr. Duchin, who sits on all those calls nationally about all of these points that you're talking about, is going to be joining us. He's going to be coming in, I think, about 2:45 during our Q&A. So I'll get through a bit of a presentation, but let's hold those because you can get the latest from him. It seems like almost every day he is on calls. Everybody is concerned about the mixed messages that are coming nationally. There's been, I'm very proud to say, the Big Cities Health Coalition, of which Public Health Seattle King County is a member, sent a letter along with the National Association of Local Public Health to object to sort of the mixed messages coming, and that we needed to make sure that the trials were successful and that we had a safe vaccine. So lots of work continuing on that. But Dr. Duchin will be here.
Board Member Honda.
Thank you very much. Director Hayes, could you send the farmers market information to me also? I'm on the board of our farmers market here in Federal Way, and we're still struggling to make it this year. It's been difficult with the restrictions that have been placed on the farmers markets. And also for the restaurants, do they need to request from the public health to have a permit extension, or is that just automatic to renew their permits?
Yeah, so great questions. So yes, Anne will get information out to you on the farmers market, the work that's going on. Happy to do that. On the extension, so the program knows who has paid their yearly fee and who hasn't, and so that's the 8% that I mentioned. So what we're doing is working with everybody that hasn't paid, trying to contact them. And then for those that have paid, we're going to be rebating, doing that look back as well, so that it's fair across to everybody. So if you hear of somebody that has a question about that, they can contact us and I'll get them to program.
Okay, that's good to know. And the question on playgrounds and opening playgrounds up, I'd like to understand how playgrounds are dangerous for children. You know, I know that we don't want children around other children who are sick, but it seems to me it would be healthier to have children have a place to play. A lot of families don't have a playground situation for children to run and climb and that kind of stuff. And if they are wearing masks and using sanitation, washing their hands and that kind of stuff, how is that not a safe situation for children?
So, of course, we are extremely concerned about the implications for children right now during COVID. So, again, the governor's guidance is what we have. We haven't done King County specific, and I'll double check, but we have not done King County specific guidance different than what is in the governor's guidance. So let me reconfirm that and have Susie send a note as a follow-up out to the board on the guidance around parks.
Okay. Yeah. Because at daycares, they have playground equipment and children are able to use the playground equipment in the small areas that they're in at their daycares. But I would just like to see our kids have more of a way to get their energy out and to stay healthy and active. So thank you.
Mm-hmm. Thank you.
Fellow board members on.
Yes, thank you, Chair. I'm excited to hear about the shellfish beach getting clean again. I think that's amazing. And also your report about the air quality and the smoke. My question on the smoke is this. I understand that we had similar issues in 2017 and 18, and it seems to me that wildfires are getting worse and worse each year. So are there some lessons learned from this current incident of such poor air quality and things that we should be planning for or doing differently in terms of prevention or preparation for our community?
So there was a perfect storm this year. So compared to a couple of years ago, yes, we're seeing definitely the extension of climate change and what might herald what we are going to be seeing. Between the city and the county, there are groups and with the Puget Sound Clean Air Agency talking about what to do, how to give the earliest warnings. One of the problems with what happened this week was it was extremely difficult to predict for the weather agencies what was going to happen. And then as I was actually in a meeting, someone was actually watching the plume come right up I-5. That was a merger of fires in 3 different areas, from Oregon, from Eastern Washington, and from California coming up, and it just converged and then settled in our area. Well, not just our area, but you could see it all up and down I-5. So the state is very concerned. You probably heard Governor Inslee talking about this as well. So the State Department of Health will also be talking with all environmental health, but it needs to extend to the social service agencies. I mean, this is going to be a big discussion that had already started. We'd already, every year we go through fire season planning to make sure there are protocols in place for different things. But I really want to reinforce and agree with you that it's very sad to say, but this may be part of our future.
Okay, thank you.
Board members on, I always appreciate enthusiasm about cleaning up my district.
Well, we're all in this together, right? Cities know no boundaries.
Indeed. Anyone else? Board Member Hayes, I want to thank you very much and look forward to continued conversation in today's meeting. We'll now transition to our next item, a briefing on the behavioral health impacts of COVID-19 and the pandemic facing our county and our country and the globe. This is something that was requested by our members and part of our work plan for the year. We're very grateful to have with us Lauren Rickard, the Senior Director of Development and Community Relations from Crisis Connections, to share what they're hearing and seeing in our community. Following her update, we'll also hear from staff from Public Health. With that, I'll turn it over to Lauren Rickard.
Wonderful. Thank you so much. I'm going to share my screen here. I do have, let's see, presentation for you. Okay, can everyone see my screen? Yes, okay, great. So yes, thank you so much. Good afternoon. I am Lauren Rickard, the Senior Director of Development and Community Relations for Crisis Connections. If some of you are not aware, our overview of programs is very quick here. We have our 24-hour crisis line. We have Washington Recovery Helpline, Warm Line, Teen Link, 211, and Support After Suicide. We are a hub for support and resources in King County and as well as the state of Washington. So just to give you an idea of how much call volume we have in any given year, this was last year. We received over 280,000 calls to Crisis Connections in our various lines in 2019, and this gives you a breakdown of the different call volumes that we have.
Sorry, Ms. Rickard?
Yes.
I'm sorry. I don't see the slides advancing. I don't know if somebody else sees that happening.
Do you not see that? Okay, let me see.
We're still on slide 1.
Interesting. Okay, let me see if I can. And then.
We appear to be on slide 6 now.
Okay, great. Perfect. There we go. Okay. Okay, so update on Crisis Connections during COVID-19. So in 2019, we averaged around 780 calls, but as in the beginning of COVID-19, around March, we were seeing about 2,280 calls a day. We were receiving a 73% increase in call volume on our King County 211 line, specifically between March and May. And there were a few factors related to that. Individuals who have lost their jobs due to COVID and have never accessed social services or social determinants of health before we were helping them navigate these systems. Also, during the middle of March, Washington 211, which we are a part of that network, was activated by DOH to be the COVID-19 information line. So we were answering calls from individuals who needed support specifically around COVID-19 spread, testing, and questions on stay-at-home orders. We also would see patterns that calls would increase right after Governor Inslee would make an announcement. Also, United Way of King County partnered with us to be the triage line for individuals looking for rent assistance, which lasted around a month. There was a huge spike in call volume and there was a huge increase in our language interpreter services. So individuals calling where English is their second language. Just to give you an idea, normally our language interpreter services ranges around 3,000 to 4,000 a month. Well, for March, it was around 19,000. So there was a huge influx in folks who needed services, specifically rent assistance. Top needs for King County 201 since the beginning have been around rent assistance and shelter, utility assistance, specifically electricity. And we have seen over the summer the increase in our crisis line volume, 20% increase in call volume, starting around April, but more in the summer. And we believe this is because individuals that have now been isolated because of COVID-19 over a few months, our emotions and behavioral health emotions are surfacing. So the behavioral needs are more so now than ever. Typically, they range from calls around this range from loneliness, depression, to anxiety, to stress, and unfortunately, suicidal ideation. We also have seen suicides go up in the last few months. We are sending out more CC Cares packages to families who have lost a loved one to suicide. We have seen a 10% increase in package volume compared to the same time last year. I don't know if you're seeing it. I haven't went to the next slide. Do you see the next slide? No, okay. I don't know why it's doing that. Well, we are part of Washington Listens, which is a federally funded program through Washington State Healthcare Authority in response to behavioral health service needs as the result of the COVID-19 pandemic. Washington Listens, which is a statewide program, will relieve stress on behavioral health crises networks by giving people an outlet for their current stressors and providing referrals to services. Washington Listens is a support line that was stood up by Crisis Connection and is partnership with regional partners, including Community Integrative Health Services, Colville Tribe, Swinomish Tribe, Frontier Behavioral Health Services in Spokane, Okanagan Behavioral Health Center in North Central, and American Indian Community Center. Washington Listens is available to anyone in Washington and is free and anonymous. Callers receive support and connection to the community resources in their area. So we're very happy to be a part of that particular COVID-19 response for behavioral health. What I'll be able to do hopefully is be able to share this with you. Let me see if I can find resources available for folks. Around all of our lines, support resources, as well as training. We're doing all of our training now online versus before we were doing it in person. So that's kind of what we have been seeing as COVID-19 has hit and the impact it's had on our community and our organization, and what we're doing to try to support our community members in King County as well as statewide. Thank you.
Thank you very much. Questions of Lauren? Board Member Morales.
Thank you. Thank you, Lauren. I apologize. I didn't see this slide where you talked about the suicide. Can you talk a little bit about if you offer prevention services and what you mentioned an increase? If you could talk again about what percentage increase you've seen over what period of time?
Sure. So we provide, on top of our crisis services in 211, we do provide what's called support after suicide, or we call postvention. So we provide wraparound services and support for the family and friends and loved ones who has lost a loved one to suicide. And so specifically, we have a CC Cares program, which we provide care packages to the families and the loved ones to be able to support them. So it provides resources for them and a way to get a mentorship of a volunteer to be able to talk to them about their experiences and be able to help them through that. And so we've seen an increase in the request for these packages for folks, for individuals and families who have lost some suicide. So we've seen that all over the state of Washington because it is a statewide program. Yeah, you're welcome.
Anything else? Board members on, and then board member Honda.
Yeah, thank you for the presentation. I was looking at some of the data that was in our packet materials, and it talked about, it looks like 1 in 6 middle school and high schoolers have attempted suicide. That is just frightening in terms of the number there. And so I do think about what is the upstream prevention piece associated with that. I think that you talked about the incidence of depression going up 70%. And then the domestic violence, though, the percentage of calls has decreased. And it seems to me that the decrease is not necessarily an indicator that there's less domestic violence in the household, more of that because maybe more people are sheltered at home, that they're not actually able to do the outreach to get help. So I think about just the upstream things that we should be focused on related to all of these mental health issues that, as you say, every time something happens about an announcement, you get a spike in calls. So I'm wondering if you could comment on are there some discrete things we could be doing today amidst everything else that we have a need for with rental assistance and food assistance and whatnot. And then my second question is, Chair, we've talked a lot on this board about racial equity, and I'm just wondering if you think about your demographics and the data, what that might tell us about how things are going related to our community around equity. Are there communities that are more at risk, or are you getting more calls from a certain demographics?
Sure. So to address your first question around preventative, we're actually offering as a partnership with the Washington State Hospital Association to provide suicide prevention trainings for the schools all throughout Washington State. We have had to change it a little bit now that it's virtual because it was to be in-person trainings. So we are now working on that virtual training aspect, and we're trying to get it into all of schools as much as we can to be able to have that as an opportunity for children and youth to be able to connect and talk about it and talk about what's going on. And so we're working really hard to try to do that piece. In terms of if we're seeing call volume in different areas related to domestic violence, I don't have any specific information, but I can get that for you. I don't have it in front of me. But we are seeing related to the rent assistance, which was 211, the language interpreting services was a lot of many different Asian cultures that were really needing a rent assistance. And then we're also seeing, especially in the different other counties within the state of Washington, the need for Hispanic and interpretive services around that. And so we have actually been adding a few of our staff members they speak fluent Spanish, who are able to connect with them directly versus using an interpretive service. So we're trying to figure out ways that we can connect with individuals so they feel a little bit more comfortable talking with someone who's on the phone that speaks their language.
So really partnering with community-based organizations, perhaps to have that culturally appropriate language and outreach.
Yes, specifically in Washington Listens as well. We do have a couple of partners from the tribes, and so we are working with the tribes to make sure that they feel comfortable talking with one another and with their connections that we have. So it's been working really well. We've been seeing it's in brand new lines, and it just started in the beginning of June. So we have already seen an increase. We're getting about 1,000 calls a week right now on the Washington Listens line.
Thank you very much.
You're welcome.
Board Member Honda.
Thank you. Have you had increased calls since school has started and parents and families are trying to juggle school and work and childcare?
We haven't seen a specific increase in that. It's really based on what individuals choose to share when they're talking with a phone worker. So they may say they're feeling stressed out or worried, but they may not say exactly what. They may just say COVID-19 in general. So sometimes it's hard to get specifics on that. But I can also see if there's any relevant information on that. I can double check with our crisis line.
Thank you.
You're welcome.
Other questions? Lauren, I really want to thank you for joining us today and your presentation on the work that your organization is doing daily in our community. And I've had the pleasure of working with you and the organization for years on a variety of topics, and really appreciate not only what you've spoken of today, but the work you do in our community every day over an extended period of time. Thank you so much.
Thank you, Council Member. Thank you so much. And I apologize about the slides. I'll make sure that you guys get this full deck after the meeting.
Quite all right. Thank you. And now I'd like to turn to public health staff. We'll be joined by Marguerite Rowe, the Chief of Assessment, Policy Development, and Evaluation Unit, and the Director of Chronic Disease and Injury Prevention, and Sarah Wilhelm, the Community Wellbeing Group Supervisor for Coronavirus Response and Strategic Advisor for Trauma-Informed Systems in Best Starts for Kids. If I'm counting right, that was 2 long job titles for both presenters. And so I appreciate the fact that they're taking time out of their 4 jobs to join us today.
Thanks very much. Thank you very much, Councilmember McDermott. Really a pleasure to be here again. I am Marguerite Rowe, Chief of Assessment, as you heard. Can I do a time check, Councilmember McDermott? And if you want to let us know how much time, so we will adjust our presentation to you.
I don't have a time chart in front of me, Marguerite. If you, how long did you plan on using? If you have a time goal in mind, go ahead and work with it.
Okay, we will try to speed through this because I know that you actually have many other important items to talk about. We want to make sure that you have a chance to talk with Patty, Director Hayes, our Chief Medical Officer. So thank you again. I'm going to switch to slides. We'll see if this works. We will see. And I appreciate knowing that many of you have actually already looked at the set of slides. So I am sharing my slides. Would Councilmember McDermott, would you let me know if you are actually seeing the slides?
I am indeed.
All right, great. So again, thank you very much, and I will just move on through the slides. So hopefully, I will hide so that you're not looking. You're not looking at yourselves. I don't.
We also have some ability to move and reduce how many screens we're seeing.
Okay, so hopefully you're seeing a full the full slide now. Again. Thanks for looking at the data. And I believe we've shared this with you before, but if not, I just want to reiterate to you sort of what we are doing. So the Public Health Department is in partnership with the CDC as well as the Washington Department of Health on a CDC-funded evaluation to look at the economic, social, and overall health impacts of COVID. And this is a multi-year study that we will be looking at. And what we've tried to do is we've actually tried to create a dashboard that is available on our kingcounty.gov COVID impacts dashboard. And you'll see that we have many dashboards that are being created thanks to the great work of our communicable disease EPIs, as well as our epidemiologists in APDE. And for this particular study that's funded by the CDC, we cover a number of different issues, from the economic impact to the social impacts, and to some measures around health. Now, it never works over Zoom to do a live demonstration, but what I will say is that if you go to the website and the dashboard, and for instance, if you hover over one of the areas, whether it be unemployment or behavioral health, and you click on it, it will open up into additional information and data that you can explore. So today you had asked for an update on mental health and behavioral health impacts. In short, I want to present just a couple of slides that draw your attention to a couple of different points. One is really that we have seen an uptick in behavioral health needs and mental health concerns. For instance, we've seen depression increasing 69% between late April to mid-July in Washington State. The highest levels of depression are amongst those who've lost employment or live with somebody who has lost employment, certainly those who are in our lower income tiers, and people who are self-identifying as Black or multiple race categories. You heard from our partners in the crisis clinic, and we thank them very much for their partnership in helping us provide data for our dashboard. And you'll see that again, as was mentioned earlier, there's been an uptick in the calls for the need overall, but specifically for the behavioral health crisis line, we've seen a 21% increase in July over what we saw in the previous year. Interestingly enough, around the issues around suicide, and we are actually trying to work with our medical examiner's office to work on getting you more up-to-date data, because we know this is a topic that you all have been very interested in. But we have been also tracking the emergency medical service data. And for this period during COVID and the stay-at-home order, actually suicide-related EMS and emergency departments actually declined at the start of the pandemic. And what we saw in general was the number of EMS calls actually went down. So this is an example of some of the data that you'll see on the dashboard that is created. And again, here I wanted just to show you a little bit that we are actually tracking the data week to week. And you'll see that since the beginning of the epidemic, and this data actually only goes back till April, but from the end of April to mid-July, you'll see that whether it's depression, being worried, or anxiety, that we are actually seeing increases in each of these questions that are asked. I want to turn your attention actually to an issue that is not, we have no evidence and no data that says this is due to COVID, but it's an important thing that is happening during the time of COVID. And so it was important for us to let you know about the major increases in fentanyl overdose deaths. In fact, today, fentanyl-involved deaths represent 37% of overdose deaths, which is up from 1% in 2015. We're seeing twice the number of fentanyl deaths in the first half of the year compared to the same time last year. And really disturbingly, I want to call your attention to what's happening with youth. And youth, when I say youth, it's 18 and under. So in the years of 2016 to 2018, we actually only saw one overdose death due to fentanyl amongst youth, one death per year. Last year, we saw 9 deaths. Data that we have right now today through July show that there have been 11 fentanyl overdose deaths amongst youth 18 and under. So I am not the expert on this issue. Just if you're asking, if you have questions as to, potential reasons why, one of the things that we're seeing in the market is that we're seeing a flood of fentanyl coming in as counterfeit pills. And so these counterfeit pills look very much like their Percocet or their Vicodin. So you can imagine how easy it is to mistake and think that this is not as serious as it is. And please know that if you would like more information, happy to have staff come back and give you a deeper dive on this issue. So I'm going to wrap up from the data because I want to make sure that Sarah Wilhelm, my colleague, has time to tell you actually what we're doing to help prevent and address some of Councilmember Zahn's question about how are we preventing and how are we addressing the uptake in mental health concerns and behavioral health concerns. But to share again that we have an interactive dashboard. This is sort of just, it's a very small shot, but I will say that what we are trying to do is to provide you the data. This is a screenshot that we have around our depression and anxiety data. We make sure that we disaggregate that data by age, by gender, by race, ethnicity, and many other factors. We are writing technical briefs for those, both at the CDC and to help inform the field and providers. And in addition, we have created these infographics for you and for others to use in your community. And with that, let me turn it over to Sarah Wilhelm. Sarah?
Thanks so much, Marguerite. I'm Sarah Wilhelm, and thank you so much for having me. I have the privilege of leading our community well-being group, which is a part of public health's COVID-19 response. And I will I'll move quickly through this, but you have the slides, happy to answer any questions and or refer back for additional information. Just want to give you an overview of the work that our group is doing. Next slide, please. So we're really aiming to take what I would say is a public health approach to supporting the mental health and well-being of everyone, all of our communities in King County, but with particular emphasis on those who are most impacted by what we're really seeing as intersecting crises of racism and the pandemic. So we definitely look at and have partnered with Marguerite's team in terms of looking at the data, both around behavioral health and around the impacts of the pandemic, and working to reach those communities. And again, we take a broad view of emotional health, and really see it as being grounded in holistic individual and community health. So with emphasis on the individual and collective systems and structures that we all exist within, and recognizing the importance of just and equitable systems and structures as a component of emotional health. Next slide, please. And these are just sort of some guiding principles to our work. We are really aiming to validate and accept the very complex and wide-ranging emotional and psychological impacts of the pandemic on all of us in various ways. We are working to address the stigma associated with mental health. Obviously a long-standing issue in many of our communities predating the pandemic, with some, like many things, some added layers these days. We are taking, again, to board member Khan's comments earlier, really an upstream kind of promotion, prevention oriented approach. So really looking to promote compassion, care, and connection at a time when we understand that those things can be challenging given distancing and everything that we're going through. Promoting accessible, just, and equitable behavioral health supports, and again, looking broadly at what behavioral health supports can mean culturally and community centered, and finally just sharing a variety of resources to center communities and their lived experiences. And I just wanted to also call out that we are collaborating with and working very much in support with the King County Behavioral Health System. So King County's Behavioral Health and Recovery Division in our Department of Community and Human Services has for many years managed behavioral health services for our Medicaid eligible population, currently called the King County Integrated Care Network, by contracting with those over 40 provider agencies. This is obviously critical work all the time, and all the more critical right now as we see these growing impacts that Marguerite just presented. And we are really aiming to augment and perhaps move a little upstream from the work that they're doing. Those on-the-ground services for some of our most impacted populations are critically important. They also work with Crisis Connections and contract with Crisis Connections. And finally, we have a nice partnership with them around mental health first aid training, which I'll talk a little bit more about in a moment, but that is really a community capacity building approach to help our communities learn about mental health issues and learn how to talk with one another about mental health. So that's a nice example of our synergy and where our work does come together. Next slide, please. I wanted to highlight this graph, and I'm happy to share the resource as well. The State Department of Health also has a behavioral health group in their COVID response, and they have done some really nice modeling of mental health and impacts of the pandemic, and they update those models on a regular basis. The models are based on previous experiences with disasters, as well as bringing in some local statewide data. So this graph simply shows you, and this is very high level, and you'll see the note, a couple notes here. One is without additional pandemic waves, so this is just sort of a high level if we were to ride this wave out, what this could look like, and clearly without many of the other layered impacts, smoke, et cetera, that we have going on. But what we would typically expect to see is at the start, so timeline on the left is the start of the pandemic, an adjustment period where we will see some of this kind of acting out frustration and just, really unease with this radical change in all of our lives. That can move into feelings of depression, grief, or loss as we start to understand the significance and also the duration of this. And then we can move into what is sometimes called a little bit of a honeymoon phase, where we've gone through that major adjustment and we're able to maybe focus perhaps a little bit more on prevention, resources, and kind of take a breather. And then we'll move into, particularly for our own timeline here, that 9 months post-outbreak, we start moving into the fall, the weather changing, needing to be indoors more, the holiday season, which is always every year a challenging time for mental health. And the state is currently predicting spikes in suicide rates and mental health impacts to really perhaps peak end of this year and into the beginning of next year. And again, this is simply a model built on experiences that we've had in the past in disasters, but I think does contain some useful information. And then also to highlight that resilience is also built, and many people come into such a crisis as we are in right now with really strong coping mechanisms and supports, and will experience challenges, as all of us do, but we'll be able to bounce back from them. So wanted to highlight that as well. Next slide, please. So I'm just going to go into a few of our core activities. We are working with the Public Health Reserve Corps to place behavioral health volunteers in various capacities, supporting our communities most impacted by the pandemic. And I'll talk a little bit about our community partnerships in a moment, as well as providing some surge capacity for support of King County staff, including our responders. Next slide, please. So community partnerships, this is really a core element of what we are doing. I wanted to highlight this event that unfortunately was rescheduled from this Saturday due to the smoke to next Saturday, but nonetheless will go forth. This event is, you can see at the bottom a number of logos, including the City of Federal Way, who I see is on the call, and we've just been very pleased to work with the City of Federal Way and all of these fantastic partners to put together this event where our Public Health Reserve Corps behavioral health providers are able to be both on site, outdoors, masked, social distanced, as well as offering virtual opportunities to connect for community members to connect for 30-minute sessions. These are non-clinical sessions, but sessions with someone who's trained to provide mental health support and also connect with resources. We have a community mental health resource guide available on our website and that will be available at this event. And we're also very pleased to be able to offer COVID testing at this event as well. So there is the benefit of community members being able to both access that testing, and particularly some of our communities who have not had great access to testing and have been disproportionately impacted by the virus, and at the same time support their mental health. We have another event planned or in the works to be planned in rural King County in the Snoqualmie Valley area in October with a couple of our partners in partnership with Behavioral Health and Recovery and the Mental Illness and Drug Dependency Teams, Behavioral Health Services in Rural King County initiative. So we're also really excited to be able to reach some of our rural communities who we know are facing extra challenges around isolation. Next slide, please. Mental health first aid, I already mentioned. We were pleased to support Behavioral Health and Recovery Division. This is a mid-funded program again. In their pilot of the remote delivery, mental health first aid had to be adapted, I would say, fairly significantly for remote delivery. And that became available in June and did represent an extra expense to the county. So we were pleased to be able to support that and also to recruit participants for that pilot out of our connections with communities, again, focusing on those most impacted. We offered both youth and adult mental health first aid in English and Spanish. And we are continuing to offer trainings through 2020. Next slide, please. Communications and resources is also a part of our work. I have the link on here to our page in Public Health's COVID-19 site. And here you can also download in PDF our community mental health resource guide that is available in several languages. And we have also we've done a series of blog posts on the Public Health Insider blog and also sharing social media content as well. Next slide. And finally, we are really building out our work focused on families and young people. I think of extra importance as school goes back into session in a remote format, which is clearly, I can say as a parent of 2 school-age children myself, definitely an added stress. We have a task force working on these issues that is comprised of both King County government and partner organizations, some of whom listed here. Next slide. And just to highlight a few activities of our Family and Young People Task Force, one that I wanted to mention is that we are collaborating with Puget Sound Educational Service District to convene school counselors from King and Pierce counties in their service district to discuss how to support student and staff well-being as school progresses remotely. And this is an opportunity for a cross-district space for counselors to connect with one another. We are really working with them and thinking about how to promote their well-being so that they are able to continue to support young people and their families in this challenging time. Next slide. That is all I have. Thank you so much again for the opportunity to present.
Thank you both for sharing with us the work you're doing, but more importantly, for doing the work out in the community. At a time when, as you've demonstrated, it's so important to have the support for people. And the need is only increasing. Councilmember Lambert.
Thank you, Mr. Chair. Thank you for all your work. I have 2 questions. I haven't heard anything about elder abuse and also telemed and how we can hook people up through telemed since so many major improvements have been made in telemed.
So I'll say that we don't have any specific data that we have been tracking on elder abuse, but I'm happy to go back to my team, Councilmember Lambert, and see if there's anything that we have that would help give us some sense. I will say similar to the questions around domestic violence and some of the data, it's a little bit challenging right now. We certainly know that we think that there are many things that are happening, and we're hearing anecdotally, so qualitatively we're hearing from our communities, and whether it shows up in the quantitative data, that's something else. On the issues around telemed, I will see if Sarah Wilhelm has anything. I do know that we have staff who are actually online as well, who can talk about certainly telemedicine and SUD if you're interested, but we'll leave it to your direction.
I'm very interested. I've had several seniors say to me, they won't even let me out of my room to go and eat. They bring the food to me and put it by the door. I have nobody to talk to, and I'm in a one-bedroom place. I don't even know if I want to keep on anymore, if this is what my life's going to be like at the end. And so as we're looking at our convalescent places, to be asking them, what are your rules? And maybe being able to get a group of 4 or 5 other people who are living in the facility to become a quote, quote, family. So they have somebody else to talk to. But I was getting phone calls at all hours of the night, which, you know, is good. But it was sad because they didn't have anybody else to talk to. So they called me. And, you know, it made me sad. I wanted to go up and play cards with them or something, but I knew I couldn't do that. So I think that because they're a separate group, that it's kind of like, okay, because you're more frail as a group, you know, there's less scrutiny, I think, on them than on some other groups. And I think it's important that we honor our seniors too.
Having elderly parents myself, I completely understand. So thanks for raising that.
Thank you.
Board Member Morales.
Thank you. Thank you both for this this presentation. I will say that there are lots of services you talked about that I was not familiar with, so I appreciate that, and we'll look a little more carefully at the slides that you've sent to us. I'm interested in knowing, you mentioned several, I don't know if they're sort of escalating issues that people might have, you know, grief, depression, acting out. I didn't see a lot about substance abuse. And, you know, I know that there are lots of folks who are, you know, that's sort of how they are coping with some of these issues, especially COVID, and can have really dire consequences. So can you talk a little bit about whether any of your programs do provide support for folks who are dealing with substance abuse, or how we might connect people, particularly who may not be from the dominant culture, if there are programs that are tailored or crafted for people who don't speak English as a first language, for example, or other culturally appropriate services that we can think about directing people to.
Yeah, thank you for that question. I'll just chime in and then see if my colleagues have anything to add. Yes, we definitely do, although I didn't highlight it in the state projections, we definitely do see substance use and increasing issues coming along as the pandemic progresses, as sort of a comorbidity with the other mental health issues that are going on. And our team does provide resources you can see on our website and in our resource guide. We also have adapted that resource guide, although it's not on our website, for some specific communities at their request. So for example, we have a resource guide that has been adapted for the Black community and was developed in partnership with the Seattle King County NAACP. So we're looking, and that includes some substance use resources as well that might be more culturally situated, because we do know that that is definitely an issue. And yeah, I think, I'll just stop there and see if my colleagues have anything to add.
Councilmember McDermott, if it's okay, I'd like to invite Brad Feingood, who is also public health staff, to share with you all what we're doing around substance use.
Of course.
Brad.
Thanks, Marguerite. Thank you, Councilmember. Thank you, Councilmember Morales. And this leads a little bit also to Councilmember Lambert's question around telemedicine. So as Marguerite said, we've seen a huge increase in fentanyl-related overdose deaths coming in the form of counterfeit pills. We've also, as Sarah talked about, seen an increase statewide and problematic drinking and so on and so forth. The top resource that we have available through the Behavioral Health and Recovery Division is the Recovery Hotline, the Recovery Helpline, which presented from the Crisis Connections earlier. And the whole recovery treatment community has just been amazingly malleable and flexible in this time of COVID. So they do actually most of their work now, home medicine when it's appropriate. They do face-to-face when it's appropriate also, but we've been able to start people on medication-assisted treatment. We've been able to have people receive care, in the comforts of their home, whether it's phone or video. We have a culturally diverse provider network where we have agencies like ACRS, which works with the Asian Pacific Islander community primarily, or Consejo and other communities that work with Latinx community. And so through the Recovery Helpline, they can be channeled to all of these, to this tremendous amount of provider network, whether they have Medicaid or whether they're low income. We have that whole provider network available.
And lastly, I'll just remind you that we do have a tobacco prevention program as well as a youth marijuana prevention program that's funded by the state, working with schools, working with community groups to address some of those issues as well.
Thank you. Further questions? Board members on.
Yes, thank you, Chair. So I want to really appreciate the dashboard and having it be interactive. I think it's very helpful to see that. And I was actually excited to know that King County had a community well-being group. I think just knowing that there's a group that's exclusively focused on that is very, very helpful. A couple of things, I really appreciated the comments about the telemeds, because when I read about the mental health first aid training, I would highly recommend that we don't make it just a 2020 item because of COVID, because I do think that there are going to be others that may not be able to get to a actual location for that training. So the ability to offer that virtual training beyond 2020, I think would be very helpful. Because I think what we're finding with COVID is that there are other communities that maybe we haven't reached in the past because because these trainings require you to actually physically go to a location to be with a group to be trained. So that's one of my comments. And then the other one is when we think about the fentanyl overdose and just the increase in the amount of overdoses, and this is when more people are staying safe inside their homes. So what else can we do or are we doing to get at the flood of counterfeit pills that are showing up with fentanyl? I believe that on the east side of King County, we had a couple of youth that were part of the fentanyl overdose deaths and had some meetings in the community to talk about it. It is just heartbreaking. So I'm wondering if there's more that we could be doing in that area that we aren't doing yet. Thank you.
Brad?
Yeah, I mean, it might be, thank you, council members on, it might be a longer conversation for another time. There's, under Director Hayes, we've done a tremendous amount of work trying to get information out when there was, obviously COVID has changed things and how we've disseminated information has changed so much. We have a whole communications campaign geared especially towards youth and young adults around fentanyl overdose, because we know it's disproportionately impacting younger people who are much more experimental with use of prescription pills. There's less stigma around it, but the lethality risk is through the roof. And so we're continuing to do that. We also have some qualitative and quantitative research projects going on to try to understand the population a lot better. This is a population that hasn't shown up in a lot of our traditional service systems. So we're trying to figure out how to get messaging and what is the right messaging. We don't want to inadvertently have people seek these pills out. So we're trying to get communication out across the community. That's an ongoing effort, and we're trying to hone the communication to make sure that it is the right communication. Also, it is super duper scary, and the fentanyl overdose trends, which continue to go up, we're starting to see that look very much like other jurisdictions in the United States and north of us in Vancouver that have seen that exponential growth and trying to get ahead of it. But the whole West Coast is seeing this right now. We had just real quick on supply, number of pills that we've seen in the community seized by law over the past 3 years alone have grown exponentially too, from like a couple hundred to 250,000 to there have been 2 huge busts that have been in the news during COVID. So the supply and the flood is tough to get in front of.
Okay, thank you.
Well, thank you, Councilmember McDermott. I saw that Dr. Duchin has actually joined the meeting. So we are always, as public health staff, happy to share our work with all of you and appreciate the comments and the questions.
Thank you very much to you and Ms. Wilhelm for your ongoing work and for taking time to share it with us today.
Thank you.
And with that, we'll move to item 9 on our agenda, which is a briefing on COVID and flu updates with Director Hayes and Dr. Jeff Duchin. And just so that everybody is aware, I understand that Dr. Duchin has to leave us for a call at 3:15. So I want to set realistic expectations about the amount of time we have with Dr. Duchin. Director Hayes, were you going to begin?
Yeah, I was. Thank you so much. And welcome, Jeff. I want to just, for a couple of minutes, give the board an overall update, and then I'll just turn it over to Jeff so he can give his comments, but also I know you have questions about what he's hearing about the COVID vaccine development and timing, as well as his view of the importance of flu vaccine and the potential danger of the flu season on top of COVID. So I'm just queuing him up while I'm going to share my screen here. All right. So I have got our dashboard here. I'm sorry, it's too small, but it's our indicator dashboard. I wanted to show you this. This is the latest from yesterday. You can see that, and if you've been watching the numbers, our case count has been just slowly and steadily declining over the last number of weeks. That's the very top measure up there. We are at a current status there. You can see a 55 per 100,000. That's within that moderate range. So we've moved out of the high range into the moderate per the data that was put out for decision-making of schools reopening. So we're now watching this over this week, and I'm going to be on a call with some schools and school districts and the Puget Sound ESD to continue talking with them about the horizon to begin to bring the youngest children back into the classroom, or a hybrid approach rather than all remote learning. So that number there is important as a marker for them. The next one, which is green now because it's below 1, really shows how the infection is occurring and the transmission. You can also see that in terms of the hospitalizations and the deaths, were in good shape. We have been doing more testing, but as I said at the very beginning of the board meeting, with the smoke, the number of tests have been down 10 to 15% from the Seattle report. And I expect that hopefully to improve next week. but with our new sites in the South End, even though we had to close them because of the smoke for a couple of days, we are continuing to work to open those sites in the South End where we know that there is a higher need for testing in those areas and on the east side. So we're continuing to watch for those gaps and to move those resources in there.
Patty or Mr. Chair, may I just request something?
Councilmember?
Thank you, Mr. Chair. Patty, can you enlarge this on the screen? It's very small.
I know. It's going to get better after this slide. I'm afraid if I do this, I'm going to lose. Let me try this. If I lose control of it, then...
I'm sorry.
No? All right. We'll see how well you're... you all know that I don't have the best karma with technology. I think we've experienced this before. So just be patient with me. So here's a lot better, isn't it? It's full screen now for you. Okay. You can probably read some of it now. This is our indicator dashboard that's on our COVID webpage. And it has what the metrics are, what the target is, what our current status is. This gets updated every Wednesday. I wanted to just highlight again, this was mentioned in the previous in our previous meetings, and also Marguerite mentioned it again. We do have ongoing racial disparities with COVID. Even with our numbers going down slowly, we're still seeing disproportionality in these different communities. And as you see, particularly our BIPOC community is just hit a lot harder. And so with the maps that we put, you can see an example of one. It really shows that relationship. There, again, this is another dashboard. I've got the link embedded into the slides, and would really encourage you to continue to go to those dashboards. I wanted to show this. This is coming from CDC in the state as a visual about what's called containment measures to box in the virus. It shows the various activities we're doing, testing, rapid isolation is the goal, identifying contacts, quarantining those contacts, etc. This is a core component. But when our numbers were up so high, I really have had a lot of questions about, well, what's the balance between the community mitigation where we all must pitch in, wearing a mask, physically distancing ourselves, and staying home if you're ill, keeping gatherings small, washing your hands, et cetera, et cetera. What's the balance here? And what we know is that when our containment is stretched, when the numbers are high and we have a lot of the virus infections going on around, bless you, Mr. Chair, a lot of infections going on, containment is stretched. And so at those times, the community mitigation strategies become even more important and more emphasized. This is important for the board to know because as you're going out and talking to your constituencies, I need your help in helping people not think that just the contain the virus, the testing, et cetera, is the way out of this pandemic. It really takes all of these things, and this gets to Board Member Mosqueda's question in relationship to when a vaccine and how does that fit with all of these strategies. So I'm starting to use this in my conversations with local elected officials and the community so that we help get a broader understanding of how these strategies work together. And when we emphasize one, I'm really happy to tell you that in the last, I think it is last week or so, and Jeff can correct me, because our numbers are down, we are now doing 100% of our own case investigations and contact tracing. As you may recall from our report, 2 months ago, the Department of Health was doing about 60% of our cases. We do a more in-depth interview process and work in our case and contact tracing into our case management system. So it's really, really good that we are able to do all of our own work here. And of course, when we all pitch in, kids get to go back to school and our economy opens. So this is, you'll start to see this new visual that we're creating that I've been using in working when I get on, for example, with different groups so that they understand that these things are at risk if we don't all pitch in as we can. And of course, there are communities where their vulnerability, they're essential workers, they have to be out and about. And if we don't all support each other, then the essential workers are higher at risk, and we see those outbreaks happening in the essential workers. I just wanted to show you, we have on our website the list of our high volume testing locations, and we're expanding this. This is just one part of the page that we have up for reference for folks. So with that, I'm going to turn it over to Jeff now, and I'll stop sharing so you can see him. So Jeff, I'll let you give a little bit more detail on the update and then talk about flu season and the development of COVID vaccine, please.
Thanks, Patty. Good afternoon, everyone. Thanks for the opportunity to discuss this ongoing, evolving challenge. So I don't have a lot to add to Patty's description of our current epidemiology. The numbers are going in the right direction. We're very gratified, and I think it's a tribute to the good work that all of us have done, our community is doing in adopting some of the basic preventive measures, decreasing our activities in the community, face mask wearing, paying attention to ventilation, good hand hygiene. I mean, those things work. And to the extent that we do them, we will see good results with respect to decreasing our risk in the community. And of course, we very much want to get the kids back to school. And so we want as much compliance with our COVID prevention measures as possible. And that's going to be required long term. I'm going to talk a little bit about influenza vaccine first, but I just want to let people know that a COVID vaccine is not going to make this outbreak disappear. A COVID vaccine, if and when it becomes available, will become available in limited quantities. It will take quite a while to get enough people immunized, should they decide to do that, to suppress transmission so that we can begin thinking about pulling back on some of these incredibly challenging distancing and mask use. We're going to need to change our ways of going about our business long-term with respect to social distance, ventilation, and mask use. So we should be thinking on the horizon of many months to years. And should we be able to change sooner than that, that would be wonderful. But I think that's a realistic planning horizon currently. With respect to influenza, the usual flu vaccine promotion activities are even more important than ever this year because we don't know what to expect with a possible combination of an influenza outbreak and a COVID-19 outbreak. We're hoping that some of the good results that we've seen in decreasing COVID-19 transmission will be sustained. And if so, if we continue to practice good social distancing and mask use, decrease our interactions with others and pay attention to ventilation and good hand hygiene, we would expect to see some beneficial impact on influenza and other respiratory virus spread in our community as well. But we can't bank on that, and it would be very foolhardy to not take advantage of a safe and effective way to protect yourself, your family, and your community, which is the influenza vaccine. So we're emphasizing the importance of influenza vaccine now more than ever. And we've got a lot of activities that our department is doing and working in collaboration with the state health department on a statewide media campaign we've been working to provide flu as well as hepatitis A vaccine at homeless shelters and encampments, in the institutional settings where we have incarcerated people in our correctional facilities. We're partnering with school districts, including Seattle Public Schools, to host drive-through flu vaccine clinics on school property. We're planning additional clinics in late fall, which will have free flu vaccine supply for people who are underinsured and uninsured, and working with Seattle Visiting Nurse Association as well to make no-cost flu vaccine available to that population. So a lot going on. We're outreaching to our communities with historically lower flu vaccination rates. Those include a lot of economically disadvantaged communities in the same areas where we're seeing disproportionate amount of COVID-19 disease. And we're hoping to have a communications campaign run by our department, as well as the state health department, to address some of the gaps that might be missed in the state's campaign. On the COVID front, things are a lot more murky, because we don't have a currently licensed and available vaccine. And although there are several and large-scale clinical trials at the moment, we don't have the results. So we don't know how well they work, in what populations they work, and we don't know their safety record at the moment. So should that information become available, we may see a recommendation or an authorization to use COVID-19 vaccine. And should that happen, I think there's broad-based agreement in the public health, the medical community, and among community-based engagement reports that suggest that healthcare providers would be the first to receive those limited available quantities of vaccine for a number of reasons. And that would include not just doctors and nurses, but everyone that works in a healthcare facility where patients are present. So all the support staff, the techs, housekeeping, dietary, nutrition, administrative, and importantly, the healthcare workers that work in our long-term care facilities, supportive living, and so on. So the CDC has thrown down the gauntlet to the state and local health departments and asked us to prepare a plan by October 16th on how we will use a vaccine that has not yet been licensed and for which we don't know the populations in which it would be most appropriate. So we're planning with our state health department on how that will work. These vaccines have some very unusual storage and handling requirements. They require special freezers that are typically only found in pharmacies or hospital pharmacies, minus 70 degrees, for example, and a lot unknown about the cold chain requirements and the handling and storage of a product that's not yet licensed. But we are going to continue to work with our state and federal partners to try and ensure that whatever data become available are analyzed in a very transparent way, both with respect to the safety of the vaccine and the effectiveness, and that we're very strongly advocating for no vaccine be made available if any shortcuts are taken in the process of evaluating and demonstrating vaccine effectiveness and or vaccine safety. So I will leave it at that, and I'm very happy to hang around and take questions.
Thank you, Dr. Dushin. And I hope you're still getting out biking on the weekends.
That's a sore point at the moment. I'm virtual biking. It's right. Kind of like an imaginary kind of thing right now.
I haven't been running since Labor Day myself.
Yeah.
Can you speak to what we might expect a reasonable or acceptable level of suppression of transmission a vaccine might have? Would it protect 50% of people who receive it, 75, 98?
Yeah, the FDA has set a standard for the manufacturers that would require at least 50%, but possibly lower confidence intervals. So when a study is done, you have a point estimate. Here's your best guess at how effective the vaccine is. But because it's a study and it's not got an unlimited number of people and observations, that estimate comes with some uncertainty. So it's possible that the lower range of that uncertainty could go below 50%. we won't know until the product is available and we see the data what the specific effectiveness will be. We certainly hope it will be higher, but even a 50% effective vaccine would be eligible for approval.
Thank you. Colleagues? Board Member Mosqueda.
Thank you very much. Thank you very much, Director Duchin. I want to say the same thing I said to you, to Director Hayes. We really appreciate all of the work that you and your team are doing, and paramount to keep your health in good shape. So glad to see you're healthy, and please know how much we appreciate your work, even though we don't get to see all of you on a regular basis. You are helping to keep us alive, and we very much appreciate that. I had a comment that I just wanted to uplift from both what Dr. Hayes said and what you said, that there is no returning back to normal. If I understood what you said correctly, and I wrote down a few pieces, we need to change the behavior, change our behavior, and I think also change our expectations about what was previously thought of as the normal, and really think about how we prevent not just COVID spread, but future transmissions of disease, if I heard you correctly. I'm wondering if I can ask two questions and maybe you could comment on them. Have you and or public health experts around the country thought more about the type of changes that we might need to recommend to especially essential workers, so that we can build in time for essential workers to have the cleaning time that they need, compensation for that cleaning time, any recommendations? Because I think we are now in a position to want to prevent this type of rapid spread in the future, and some of that does obviously require us to wear masks when appropriate, but doing simple things like having additional cleaning time and cleaning supplies for essential workers, I think, is one thing I'd be very interested in if public health is weighing in more on that. And then the second thing is on the vaccine efficacy rates. Still, I know there's ongoing concerns about not enough diverse populations being part of the existing testing. Can you comment on how the efforts are going, if you know, about trying to recruit minority populations, BIPOC community, racial and ethnic minorities to be part of the testing, and the concerns that you might have as a plea for more folks who are people of color to join the efforts to make sure that the vaccine is not just meeting general efficacy rates, but that also penetrates to diverse populations?
Well, thank you for those insightful questions. And first, I just want to say how much I appreciate your expression of gratitude. And I want to give all the credit to our team at Public Health, who are really heroes. They are working heroically like other healthcare providers are. Unbelievable number of hours, very stressful and challenging conditions in the field and in the office. And they're just a remarkable group of people that are so incredibly dedicated to their work, many of whom I think would have left if they weren't, because the conditions are quite stressful. So all credit to them. With respect to your question about the long range forecast and when we get back to normal, I saw a good analogy the other day that someone said, after 9/11, we didn't really go back to normal. We changed the way we did things about security. We put TSA in place and so on. So with COVID, it's not quite as predictable. I mean, all I can say is for the next year, 18 months, we're definitely going to need to change, and maybe out to 3 years, change our behavior to reduce our risk of acquiring respiratory viruses, just whether or not a vaccine becomes available, because it will take a while for the benefit of a vaccine to kick in. And I would say in response to your question that the current guidelines around protecting workers and protecting community members in indoor locations, for example, avoiding prolonged indoor contact without mask use, improving ventilation, social distancing, barriers where possible, environmental hygiene, all of those things will be relevant. I think all of those will continue to be relevant for the next year, let's say, and possibly longer. So to the extent that we can anticipate, that these are going to be long-term needs will help us plan, I think. So the guidance, I don't anticipate changing on how we can protect ourselves unless we get new information about, modes of transmission or effectiveness of, different types of personal protective equipment like masks that we might tweak the guidance. But I think the basic fundamental principles of increasing distance, decreasing close contact, mask use, and hygiene will remain the same. I think one thing that hasn't gotten enough attention is the importance of ventilation. It's a relatively complicated area. Summertime, there's an easy solution: open your windows and doors. But each building has a ventilation system or an HVAC, and the quality of those systems and their capacity to improve air exchanges and filter air vary dramatically. So paying more attention to that, I think, over the long term will be important. Let's see. With respect to the vaccination, so the FDA and the Advisory Committee on Immunization Practices have required from the manufacturers to enroll a representative population in the United States. And I have not seen their data, on who's being enrolled right now and how it falls out across racial, ethnic, and demographic lines. But it is an expectation, and a clear expectation that's been discussed on multiple occasions, both publicly at the Advisory Committee on Immunization Practices meetings and in the guidance that FDA has given industry, that we are very sensitive to health disparities and to inequities, and we want to make sure that the vaccines are tested in all representative groups that reside in the U.S. So when we get our first look at the data, we'll be able to comment more specifically on that, but the expectation has been made very clear to the manufacturers.
Mr. Chair.
Councilmember Lambert.
Thank you. One of the things that I'm being told is that people who have behavioral health prescriptions are having troubles getting them refilled because the appointments are low priority. And so how can we encourage the doctors or pharmacists to refill via telemedicine so that people don't have to wait months and months to get their prescriptions refilled? Okay, he might have frozen up. And then I was going to ask another question. I'm glad you talked about the HVAC system. I think that when this is over, looking at the impacts on housing, the size of the housing, the HVAC system, as we start talking about more housing, that we design our future housing with pandemics in mind. And then lastly, drilling down a little bit more carefully on what other factors are impacting people of color. Are we seeing it more in high BMIs, or are we seeing it more in uncontrolled diabetics, so that we can begin to start doing some community education or monitoring to be able to bring those numbers down? So I haven't seen anything yet that specifies what about each community is the part that we can start drilling down on to make sure that we protect everybody.
Board Member Lambert, so I have a bit of an unstable internet connection, and I think I heard the gist of your question, but let me try and answer it, and let me know if I missed some of it, because it's sometimes it gets a bit garbled. But you're asking about the high-risk conditions and how we can, try and address those and decrease the risk to our community members. And there have been some recognized, clearly obesity has been recognized, and certain other chronic medical conditions, which are listed very explicitly in the CDC's website. You can just Google COVID, who's at high risk. And the ones for which the data are more robust are listed on top. And then there's a bunch of others where it's not quite clear, but there's a suggestion that people who have these underlying conditions might be at increased risk. And it won't surprise you, because you're sensitive to health in general, that many of the risk conditions are similar to those that predispose to adverse health outcomes in general. Cardiac disease, diabetes, renal disease, some of the things that we see that are disproportionately related to the social determinants of health and other inequities that we've, tried to address in our pre-COVID lives. So I think that you're absolutely right that we need to recognize these risk factors. It's very hard, as you know, because they're lifestyle related, many of which, and they're also a consequence of long-term structural issues that are related to the social determinants, lack of economic access, poor environmental conditions and so on, lack of access to healthcare and other things that cause people to have chronic disease, including stress and racism. I don't know that we can change a whole lot on the short, timeline that, would be relevant in the context of the COVID epidemic. But I think we need to recognize that these people deserve to be protected. And so when we have vaccine available, making sure that people who are at high risk, who have underlying health conditions, would be in one of the earlier tier groups is a current priority of the Advisory Committee on Immunization Practices. Also, the National Academy of Medicine in their guidance recognized the importance of prioritizing vaccine to people who have these underlying health conditions before making it available to the general public if there was not an adequate supply. So also testing, for us, testing has been quite a big issue, making sure that we have enough testing access in those communities that have higher rates of those diseases so that COVID-19 transmission can be recognized and people can take the steps they need to protect themselves and their families to the extent possible. Those are so the bottom line is yes, we need to recognize those risk factors and try and tailor our response to the extent possible based on people's, the extent to which people are suffering from those risk factors.
As I was thinking the other day, if we were to do something like put out, a daily, they say that you do exercise in short spurts. So a 10-minute thing on meditation, and then later in the day or something, a 10-minute thing on exercise, so that we can start beginning to reduce BMI, reduce high stress, and see if that could turn around who is at the high risk and reducing it. So I think this might be a good time to start thinking about re-energizing once the whole, what are we going to do? Everybody go to your battlefields right now, which is where we've been. But as things settle down, really starting to look at what can we do to reduce hypertension and BMIs so that people will be less prone to be susceptible. And the last thing was just the idea of mental health medications, people waiting 4 months to get their prescriptions refilled, that we need to do something to make sure that it doesn't take them that long to get refills. Thank you.
Thank you.
Further questions for Dr. Dushin? Board members on.
Yes, thank you. Thank you, Dr. Dushin. I'm glad to see you're in good health as well. I had a couple of questions. When you were talking about the flu vaccine, I wanted to understand, is the goal that it would be available to everyone? Because I saw some data earlier today that there's a high percentage of individuals living in King County that are uninsured. And so the ability to make sure that everyone does have access to the flu vaccine. So is that the goal, is through these different partnerships that anyone should be able to get a flu vaccine even if they don't have health insurance?
Yes, thank you for the question. So for children in Washington State, vaccine is provided at no cost to the patient through our Vaccine for Children program, federal entitlement. And so we routinely have healthcare providers able to provide vaccine to any child, and there's not an economic, consequence of doing that. The issue and the challenge, therefore, is with adults, underinsured adults. And our goal is to provide flu vaccine for anyone who wants it. Now, traditionally, of course, uptake has been a challenge. We know that adults 65 and older have the highest rates of flu vaccine uptake at about 65%, 2/3 of them get it. And they're a high risk age group with a lot of underlying health conditions. And then our youngest children who are at high risk tend to get it very well, probably because they're routinely engaged with their pediatricians, as they should be, for their checks, and they come in frequently, and they understand and their parents understand the importance of flu vaccination. In between those two ages, we have challenges because particularly healthy young adults and adults who have underlying health conditions but are, middle-aged working adults don't seek flu vaccine or value it as much as those other groups, although it provides tremendous benefits, both in preventing influenza and reducing days of illness and need for healthcare visits and hospitalizations, but also very, very effective in preventing people with underlying conditions from having serious outcomes. So we are hoping that people will seek flu vaccine in greater numbers this year, and that's why we're working with the Visiting Nurse Association and some of our community partners to try and distribute some of the flu vaccine that we're getting through the state health department for un- and underinsured adults. So supplementing the supply that will be provided at no charge to the patient as well if they don't have insurance, and there will be no copay for that. So to the extent that we have vaccine available, now most years we don't go through the supply that we have available. So we're hoping to have better, uptake and more interest this season.
Yeah, hopefully so. I think that these are good practices to have for both the flu as well as COVID. My second question, when you were talking about improving ventilation, is earlier today, Director Hayes talked about food eateries and the protocols as they reopen and having the good practices around COVID. I'm thinking about the fact that as it gets dark outside and it's going to be cold and raining, folks that want to leave their house are going to gravitate towards indoor spaces. And the concern about how likely these different facilities are going to upgrade their ventilation, especially if their business model is already challenged with getting revenue. So are there some programs or focus areas to help with some of the businesses where ventilation may not be up to the expectation we need for COVID? Because I am concerned about as we get into winter, people are going to maybe gravitate inside instead of outside their house just to get away from their place.
That's a very important point. And there's guidance. Washington State Labor and Industries has guidance for workplaces about ventilation to help maximize whatever you can do given your current ventilation systems capacity. And we have a workplace team that can provide consultation to workplaces from the health department, and we have industrial hygienists as well if there was a specific question. But the bottom line, I think, is that many places just don't have great, high quality HVAC systems and ventilation in their facilities. And they'll look at the guidance, they'll do what they can do, but there still will be risk. And I think this is the important message for the public that, when you go into a place that's enclosed and doesn't have good ventilation, there's definitely going to be a risk for COVID-19 transmission. So what can be done to decrease the risk? Decrease the amount of time you spend in that place, decrease the proximity, decrease your contact with others, stay as far from others in there while you're there as possible. Don't get close, wear a mask. So if you have to spend a lot of time, or you choose to spend a lot of time in a place that doesn't have the best ventilation, and there are other people there, and in particular, things like speaking loudly, or singing, or coughing, those types of things put more virus in the air and increase the risk. So I think there's going to be a certain amount of personal responsibility, and we will try and give people the information they need to make good choices, but to recognize where the risk may be higher. But your question about how can we help these businesses and so on, at this point, I think what we're doing is sharing the available guidelines from Labor and Industries. There's also some very excellent information from an organization called ASHRAE, which I can't remember the acronym, but they are the experts on building ventilation, HVAC, and air handling, ASHRAE. They have an entire COVID-19 section to help people understand what can be done to decrease the risk of COVID-19. It's a very complicated area, building HVAC, engineering and ventilation. So providing information is sort of our bread and butter. As far as actually helping people make changes in their physical environment with respect to structural changes and the cost, we haven't had any activity on that front, and I'm not sure, how that will work, given the feasibility, the cost, and just the huge number of places out there, that would need some sort of upgrade if we really decided that was the top of the priority list. So I think we should go for the low-hanging fruit initially, which is to recognize the risk and take all steps to minimize our time that we spend in these environments to the extent possible.
Yeah, thank you.
And Dr. Dushin, I understand that you need to leave now, I believe, to be on another call. Is that correct?
I'm good. No, I'm good for a few more minutes. Yep.
Board Member Mosqueda, did I see your hand?
Just very briefly, I see my colleague, Councilmember Lewis as well. Just want to say for other cities out there, one of the things that we did was try to put money forward with the Jumpstart Seattle legislation that we have in talking to small businesses out there. It was something like only 1 in 10 Black-owned businesses were actually getting any of the PPP federal assistance for small businesses. And what we heard from small businesses is they just need flexible dollars to put in the partitions, the plexiglass, the sanitation stations, things like that. So we authorized funding for small businesses to have flexible funding. It got ultimately reduced by about a quarter with conversations with the executive, with the mayor's office. But it is, I think, important for us in any way we can to just sort of build on the recommendations that public health experts have put out there. And what we're hearing mostly from the small businesses that we engage with flexible dollars really help them implement exactly what was just described. Just a small piece I wanted to share. Sorry, Mr. Chair. Thank you.
Board Member Lewis.
Thank you, Mr. Chair. I just wanted to briefly, and we sort of discussed this a little bit earlier as a related issue pertaining to ventilation, but it's evident that going forward for the near future, we're going to have smoke every summer from wildfires, or at least every other summer with frequency. I think 3 out of the last 4 summers, there's been very significant lingering smoke for a long time that in the case of this summer has reached hazardous levels. So I'm curious on some of the long-term strategies that we should start looking at to start adapting for that in terms of protocols of what we should be doing as governments in regard to when we have city employees working outside, or when city parks should be open or closed, or when we should be giving advisements in the future to for people to stay inside or not go out, or have businesses open outside, even depending on the level of hazard presented by the smoke. So I'm just curious what you think some of the strategies might be as we grapple with this, because it's evident it's going to be something tragically we're going to have to be dealing with every summer, and be prepared to respond to as governments, the same way we respond to snow days or other kind of adverse weather conditions. We're going to have to be responding to this. So I'm just kind of curious what some of the strategies should be going forward.
Yeah.
If I could make a recommendation, Mr. Chair, I think this is a very significant issue. And as we know, Dr. Dushin has made climate change one of his key interest areas. But I think we could bring in some of the team from the Puget Sound Clean Air Agency and others that have been having these conversations and doing the planning, so that we could actually have an adequate time to talk about it. I'll turn it back over, Jeff, for any of your thoughts, but I think we should marker this because this is a very important topic for the board in terms of the future. Definitely want to just marker that.
Absolutely. Great thought, great suggestion. wildfire smoke is one of the most serious impacts of climate change that we have experienced here. And it's considered to be a cascading impact in the context of the COVID-19, complicating our response to this unprecedented emerging infectious disease. Other parts of the country are grappling with severe flooding and hurricanes in the midst of the COVID pandemic. So understanding that climate change, just like the health inequities, the structural underpinnings, that these things are just going to fundamentally complicate every health challenge that we have going forward until we figure out how to address them more comprehensively. In the short term, you're spot on. We need to think about smoke. We need to think about how we partner with our experts in the clean air agencies, our environmental health teams, our industrial hygienists, and the climate experts on, how we can better forecast and how we can better prepare the community. It's another thing, unfortunately, that is quite complicated and expensive. And we need to have, and we do actually have some planning, a significant amount of planning that happened after the 2018 wildfire season that allowed us to sort of get a tiny jump on this with respect to coordinating our messaging around cutoffs for human health effects. But the bottom line is it is something that deserves a lot of attention, some significant planning and some resources. And I would look forward to talking more about both smoke and other impacts of climate on health that we should be prepared for.
Thank you very much. And Director Hayes and Dr. Dushin for the suggestion that we have a more full conversation at a future Board of Health meeting. I'll look forward to making sure that is on an agenda. And with that, Dr. Dushin, we want to be respectful of your time, appreciative of you joining us today, and even more so as a number of members have expressed appreciation for the work that you, Director Hayes, and the department continue to undertake on behalf of the community's part every day and every hour. Thank you.
Thank you. Appreciate that and look forward to seeing you soon.
Good. With that, that takes us to board member updates in our agenda today. And as I mentioned in my chair's report at the beginning of the meeting, I would call your attention to the email sent on Tuesday evening by board member Baker regarding marijuana candies and their inadvertent availability to youth, and work that will continue there. Are there other board members with board member updates? Seeing none, I would ask Ms. Levy if she has a administrator's report.
I don't have anything, but I will follow up via email with you all with those updates from environmental health, the questions around parks and playgrounds, as well as farmers markets. So you'll get that soon. Thank you all.
Thank you. And knowing of no other business to come before us, I want to thank everybody for their participation today and adjourn the Board of Health meeting for September. Thank you so much.